Hello, and thanks again for joining us for part 3 of our discussion on the 4 parts of Medicare. Today we're going to discuss part D of Medicare, which is the Medicare Prescription Drug Plan. And before we get started, just a few things to keep in mind on the prescription drug plan. And people misunderstand this occasionally. Medicare does not offer a prescription drug plan. The drug plans are offered by private insurance companies, much like the Medicare Advantage plans. It's just that Medicare sets structure and minimum guidelines that those plans have to follow. So what we're going to discuss is that minimum standard that Medicare sets for the drug plans. Now, like Medicare Advantage plans, these plans are not standardized from company to company. So each company, as long as they're meeting Medicare's minimum guidelines, they can set their benefits however they want. Now, there are 4 stages to all Medicare drug plans. Now, on some of the drug plans, you may skip a stage based on how they're designed, but there are 4 stages to each drug plan that's out there. Those 4 stages are: stage 1 is a deductible stage. Stage 2 is called the initial coverage level. Stage 3, and this is one everybody knows about, it's very notorious, it's the coverage gap, or better known as the donut hole. And then stage 4 is called catastrophic coverage. Now, the way these 4 stages work, stage 1 is that deductible stage. So each drug plan can choose to set its deductible level, and it can set it anywhere from 0 to a maximum of $320 deductible. Now, most of them do have either a 0 or $320, but you will find some that have a number in between there, but they cannot set it higher than $320. So now, if your plan has a deductible, you will have to meet that deductible amount, pay it in full until you meet it, and then you'll move on to stage 2. If your plan does not have a deductible, you automatically start at stage 2. In stage 2, it's called the initial coverage level. During that stage, you will pay copays based on drug tiers. And what I mean by that is most drug plans have 4 tiers. They'll have a tier 1, 2, 3, and 4. Usually tier 1 is their generics. Tier 2 is a formulary brand. Tier 3 is usually a non-formulary brand name. And then tier 4 is typically a specialty drug. And they will set different copay amounts based on what tier your prescription or your drug falls into. Now, you will stay in that initial coverage level until you reach $2,930 in total drug costs. At that point, you will enter into the donut hole, or stage 3. Now, if you notice that $2,930 is total drug cost. It's not out-of-pocket cost to you. So what that means is, let's say you're on a medication and the full cost of the medication is $100. You may only pay a $20 copay based on that medication, but it's the full $100 that is chipping away at that $2,930 to put you in the donut hole. So just remember that's the total drug cost, not your out-of-pocket. While you're in the donut hole, you will pay 50% of the full cost for any of your brand name medications, and you'll pay 86% of the full cost for any generics. Prior to the healthcare reform, you used to pay 100% in that coverage gap, but the healthcare reform is going to shrink that gap all the way down to where it's a 75-25. You'd only be responsible for 25%, but that won't occur in full until the year 2020. The last stage is catastrophic coverage at stage 4. It starts once you've reached $4,700 in total out-of-pocket costs. That is your out-of-pocket cost for medications. It does not include the premium amount. It's just your out-of-pocket for medications. Once you enter the catastrophic coverage level, you will only be responsible for approximately 5% of the full cost of the medication. The insurance company would pay the other 95%. Now, you can go to the Medicare.gov website, and they have a shopping tool on there where you can input your medications and dosages, what pharmacy you use, and it'll shop all the drug plans that are available in your area, and it'll tell you which one has the lowest annual cost. And always remember, lowest annual cost is more important than what the premium is for the plan or what the deductible is. Other things to keep in mind: you will be assessed a 1% per month penalty for each month that you go without a plan since you were first eligible. So that's important because that can add up very quickly. So for instance, let's say you didn't get into a plan when you were first eligible at age 65 and you waited 12 months and you got in the next year. You would pay a 12% higher premium for your plan than everybody else is paying for the same exact plan. And that penalty will be assessed for the rest of your life. It doesn't go away. So there's two very good reasons to get a drug plan, even if you may not need one now. Number one, because of that penalty. Number two, because you don't know what may be coming down the road. There are some extremely expensive medications, and if you got caught just having to pay those for 3 or 4 months, could be very devastating. Another thing to remember, the plan that's right for you is 100% dependent on the medications you take. You can't compare your plan with your neighbor's plan because you may only be on one generic medication and your neighbor may be on 3 or 4 brand names. So it's completely dependent on your medications. And lastly, a low premium or a no deductible plan does not automatically equal the best plan for you. So we use that Medicare.gov shopping tool for our clients, and that's really the best way to do that. So that takes care of our discussion on Part D of Medicare, the Medicare Prescription Drug Plans. If you have any more questions or you'd like to schedule a free consultation, give us a call toll-free at 877-492-8803 or contact us at dan@seniormark.com. Thank you and have a great day.